Are you committing one of the 7 deadly sins of psychotherapy? If you're a therapist, counselor, or mental health professional, listen up, because in this series we're diving deep into the biggest mistakes of psychotherapy and how to fix them. Welcome to the 7 deadly sins of psychotherapy. In this series, we're discussing the modern mistakes of professional mental health with the hope that together we can identify better practices and improve the outcomes and reputation of the psychotherapy discipline. The first deadly sin of psychotherapy has cost us tens of thousands of professionals, weakened the power of our healing art, and is the greatest challenge for our profession's future. The first sin is important because in many ways this has led directly to the other 6 sins, so it demands our full attention. The first deadly sin is apprentice abandonment. From nurses to surgeons, from podiatrists to psychiatrists, every professional in the healing arts goes through the same process of creation. First we learn from books, then we apprentice under a mentor. Rookies are brought under the wings of veterans to help us develop the mindsets and attitudes which form the intergenerational heartbeat of a profession. Therapists are no exception to this long tradition of tutelage. In graduate school, we learn from our textbooks, but we also learn from our mentors, and later from our clinical supervisors. For our profession to produce quality clinicians, the largest influence on a new therapist should be the seasoned veteran with thousands of hours of direct patient experience. But in the modern era, clinical leadership has gone missing. Our new therapists are being thrown to the wolves and forced into conditions which destroy rather than develop their therapeutic nature. So how has modern mental health abandoned our apprentices? Let's examine 3 important areas of neglect. First, we have graduate school, the nursery where baby therapists are born. Graduate students select educational programs which they think will turn them into capable, competent therapists. But in reality, many of our nation's graduate schools have become academic, more focused on theory and research than clinical development. In fact, many schools don't have any experienced clinicians among their faculty at all. Now, to be fair, higher education is its own job sector, a profession unto itself, and it's normal for professors to specialize in scholarship and research. But without clinically experienced faculty, students fail to shed the idealism of theory and develop real-world treatment skills. The second area of apprentice abandonment are the rookie years. After graduation, a new therapist enters the field on a learner's permit. Called interns or associates, these rookies are ready to help but are still learning how to be therapists. But rookies quickly learn that the system is broken. They either pay hundreds of dollars a week for a mentor to meet with them, or they get free mentorship if they agree to treat huge caseloads of patients for low pay from a large agency. Pre-licensed therapists are required to be supervised by mentors, but to meet this requirement, they must face financial ruin and guaranteed burnout. A third area of apprentice abandonment is therapy media. Being a new therapist is a very intimidating experience, and it's common for rookies to desperately search the internet for virtual voices that might impart wisdom and insight. Fortunately, social media has plenty of people who are happy to tell you how to do this job. Unfortunately, very few of those people are qualified. As you might expect, the best therapists are too busy seeing patients to produce daily reaction videos, celebrity commentary, or clickbait self-diagnosis guides. This results in new therapists being influenced by please subscribe popularizers of therapy culture, rather than seasoned and effective clinicians. So what effect does any of this have on the profession of psychotherapy? Well, first, many professionals leave the profession. A massive industry survey recently found that 57% of all students who completed their graduate programs never went on to attain clinical licensure. It is a damning indictment of therapy education that nearly 2/3 of our graduates decide not to pursue this career. Among those who do get licensed, the turnover rate of therapists moving from one clinic to another is extremely high, with some data suggesting as much as 50% of the field changing practices every 2 years. This wouldn't happen if therapists were attached to clinics where they received mentorship and growth. Another consequence of abandoning our apprentices is that professionals become unprofessional. The absence of even-handed, time-tempered role models leads many new therapists to uncritically adopt bad perspectives and implement unethical internet fads, believing that these new approaches are a cure for humanity's problems, when really they have no place in the healing art of psychotherapy. As therapists lose credibility, the crisis of care worsens. If psychotherapy is going to survive, we have to take care of our apprentices. Graduate school programs must give students clinically experienced faculty, and every school should have a functioning community clinic where students get real-world experience along with one-on-one clinical development. A system that deters 2/3 of its graduates away from the profession they trained for is a failure. Agencies which utilize student and intern therapists must be held accountable to provide clinical development and not just sign off on notes and cash checks. Half the workforce running from clinic to clinic is evidence of an industry that is indifferent to the experience of the therapist. Lastly, as a profession, we must raise up the voices of experienced, mature clinicians on social media to protect apprentices from the influence of amateurs who are misleading them. Throughout this series, we're going to explore the 7 deadly sins of psychotherapy so we can improve this vital profession for our patients and communities. I hope you'll join me with a curious and open mind, and that this series will challenge you to discuss with your colleagues how we can all improve. I'm Dr. Jim, the Sin City Shrink. Thanks for watching, and I hope to continue our conversation.